Lee on TikTok, and now we are up on Facebook and YouTube. Hey, everybody, it's Dr. Moe. I'm here with Neil on audio on TikTok because not enough people have followed him yet.
Come on.
If you go to amstelehealth.com, there's a pop-up that says to follow Neil. So follow Neil. He is, Neil Hyzak is our lead nurse practitioner, and Ashley's actually on audio as well. She is our boss of all things at AMS. AMS is Active Medical Solutions. That is our practice, our medical practice. So although we are a medical practice, we are on here just chatting. Oh, all right, there's Courtney. Okay, we'll get Courtney on. Courtney's probably waiting. Courtney's been waiting, and I'm a slacker because I can't get my life together. So Courtney is our other nurse practitioner. She leads the red team over at AMS. So we have two different teams of care. So we do team care that way. Everyone has a provider 7 days a week that can come talk to them, which is pretty cool, in my opinion. Well, this is my opinion.
No, that's awesome. You can't talk to your regular doctor that way.
No.
Even close to a holiday, like you can't talk to them. Like I know, like Christmas is on a Monday this year. They'll be closed like Wednesday half day, off Thursday, Friday, and they won't open again until Wednesday.
Right?
Like just in time for New Year's to be off,
Well, I was gonna say this time of year is rough. I mean, with literally, okay, you can't see my face if you're on Facebook. Hold on, I gotta back this up a little bit. Yeah, this time of year is hard, especially trying to get in with like regular like life obligations, and you're trying to get into the doctor, or you're trying to do anything. This is like just not the time. Like if you get sick, you're going to the ER because that's what happens. So, I mean, not really. If you're so you can text us, but if it's emergent and you can't wait for us to text you back, then I wrote that to people this morning just in my hello and just reminding them that like if you have something emergent, you need to go see somebody in person. So if you're just hopping on, because we got a bunch of people that just hopped on, I am Dr. Moe. I am here with Neil and Courtney. We talk all things GLP-1 and lifestyle medicine, but today's Monday, so it is Monday Moe-tivation because, well, I'm Dr. Moe. And I need the motivation the most today. I'm dragging butt. I'm like, all right, time to motivate myself.
Long weekend.
Yeah. It's funny because the less clinical shifts I do overnight. For those of you who don't know, I am emergency medicine board certified. I only work at night in the ER. I will not work in the day in the ER unless it is a disaster that I get called in for. So there is only one thing that is pulling my butt in the ER during the day, unless I'm popping in to say hi. But I work 2 shifts this weekend overnight, and I'll recover probably by Wednesday. Like, I'm just bad at it. Like when you don't do it all the time, it gets way harder. Well, and when you have 20 people in your department that are 20 people before midnight that first night, 20 people signed in. I was like, yeah, this is fun.
Yeah, I felt you at the sister site. It was rough.
Yeah, and that's why I looked over. I finally had a chance to look over, and I was like, oh, God, it sucks everywhere.
It was bad.
Yeah, and my husband was a Methodist, and they were on epic downtime. That sounds funny, right? It really was epic downtime. They had 41 in the department and epic downtime, and like 25 to be seen. It was just Are you sick, Courtney? Are you sick?
Yes.
Oh, you sound terrible. I'm sorry.
That's okay. But yeah, I actually asked this weekend. I was like, is any other hospital in the area open? No.
Yeah. I know, right? And that's the crazy part. So we were talking about telehealth, Courtney. I can't remember if you were on for this, but we're talking about how, oh yeah, no, you were on for that because it's when you helped out. And I said, you can see a provider at AMS, which is Active Medical Solutions, which is our practice. You can talk to a provider 7 days a week, which is pretty amazing because the only other place you can do that is the ER.
Yeah.
So that's part of why we do what we do. So, all right, here we go. We're starting to get questions. This is great.
Woo.
Oh, Texas beer is back too. Love it. Love it. Love it. I like seeing my people, my Monday people. I'm waiting on my PA for Zepbound. I'm currently using a sample and it definitely works. 2 shots in, 9 pounds lost. Yeah. So for those of you who don't know my story personally, I've been on Mounjaro since July of 2022. If I knew what year it was, I could tell you what year that was. And I'm apparently very excited to get to 2024, and it works. I mean, it works. I would say probably half the people, it works like the first dose. That's what it did for me. You're like, oh, this is interesting. And then some people have to wait a little bit to get up to that dose.
Someone asked if Mounjaro is leaving. No, Mounjaro is not leaving. It is brand named now Zepbound for weight loss. Mounjaro will still be there, FDA approved for diabetes. Zepbound is now FDA approved for weight loss, long-term weight management.
Yep. Way to go, Dawn. Dawn said she's been on Trulicity, did step therapy, and TRICARE approved Zepbound because of step therapy.
Oh, wow.
The first one we've heard.
Yeah, and TRICARE. Holy crap, that's amazing. All right, so we'll tell our TRICARE people, don't give up hope. Just do the step therapy. Do what they tell you. Less side effects from Mounjaro than Wegovy. Our patients I've never been on Wegovy. I have not tried it because I'm too chicken to go off what works. But a lot of our patients, the patients that do have crap side effects on semaglutide, do better on tirzepatide as a general rule. Do you guys agree with that?
I think it can go either way. Some people just have side effects on one of them and not the other one. It's, pretty incredible how dramatic it can be for one versus the other.
Yeah, just adding that second receptor agonist, the GIP, changes a lot of things. That's why when people think they can do equivalent dose from one to the other,
we've made that mistake.
Oops. We think you're fine. We think, no, you're not fine. My bad.
Luckily, it was a friend.
Right.
Let's see here. Should I wait until Zepbound is available at my pharmacy before having a PA put through? I'd say get it started, depending on what insurance you have, because it sounds like with CVS Caremark they're going to make changes next year. I don't know what hoops we're going to have to jump through yet.
Yeah, if you have CVS Caremark, I would not start your PA until January 1st.
Yeah.
Anyone else, I think you could probably do it now.
Yeah, some pharmacies are able to order it. Some have it in stock already. Some have limited doses. Like they can only get like 2.5 and 5. So
yeah, one of our patients messaged she got 15.
Nice.
So I'm like, all right, it's out. It's out.
Was that in Texas? Do you know what state it was?
I don't. I should ask her. She's on School. School is our SKOOL is our and I can't stand spelling errors like that, but it's a really good platform, so I'll tolerate it. But School is a private community for our patients. It's not HIPAA compliant. We do HIPAA compliant text messaging back and forth with our patients, but School is our like safe space. It's our cheers. It's where we go to hang out. Well, and here, but this is a little bit more general.
I asked my local HEB. They had nothing above 2.5. Closest one was San Antonio.
Okay, so San Antonio has gotten them. I know Lena had said that. So what else do we have?
Let's see here. There's a lot. There was someone asking about insomnia when you just start. Yeah, it's not uncommon for some people to have insomnia. I think it's more related to like your hormones are kind of balancing, your blood sugars being normalized, and your body's having to adapt to that. So you might get some weird insomnia. It typically goes away. I don't. You know what? It does go away. I haven't seen anybody that complain about it. After like the first month or so.
Yeah. Well, and also if you have a racing brain at night that you quiet with food, or historically quieted with food, and you don't anymore, that's going to change a lot. I don't think we can speak enough to the mental and physical integration component with these drugs. I think it just changes so much, and I just think we need to pay attention to the whole thing. Well, it's almost like with the anxiety, depression, those articles that came out about, well, it causes increased suicidality. No, you just took away my coping skill, for God's sake. Like, that's all. So, I mean, food is my drug. So you take away my blankie and shit looks bad.
So Debbie's waiting on Zepbound. The doctor says it's not in his system yet. Yeah. So when I first ordered it, like I think we sent some to like HEB here in Texas, and we were getting these bounce back scripts. They're like, order something else. We don't even know what this is. We can't order it. It's not in our system. And that CVS already had it in their system. So it's just a matter of whatever system he uses for writing scripts. Is it updates?
So I know SureScripts uses LexiComp, which I found out today. Here are the things that I'm learning as we dig into this deep dive into the EMR system. Um, that so I don't know what other databases there are, but that there must be more than one because ours uses SureScripts, but I don't know what the pharmacy. Oh, I have a pharmacist that just called me today. I could ask him because I can ask him what, or you could ask Dante, I suppose. But we need to figure out like how that integrates with the actual store. Like the pharmacy itself talks to what we order, and there's a gap there somehow. So I don't know how long. I mean, I would think Eli Lilly would get that out like ASAP, right?
Yeah, push that. People can't order it if it's not in there.
Right. Okay. You know what? Speaking of which, if your doctor says they can't, uh, sorry, never mind. I'm up.
What are you gonna say? The old-fashioned way? He can write it out.
I was gonna say call it in.
Well,
Um, just have the front office staff call it in instead of ordering it electronically. Um, or pop over to us for a month. We'll order for you. Sorry, that was all right. That was an unabashed. Let us take care of you. That's my whole thing, right? I'm always out to solve things. So I'm like, no, just we'll fix it for you. We'll fix it. We can fix it. Oh yeah. Okay, insomnia, step therapy, TRICARE. What am I missing? Um, afraid of the possible side effects. I get that. I'm going to try a new medicine tomorrow, and I'm such a weenie. I'm like, but I'm afraid. But then I decided that okay, so we have positive effects and negative effects because some of the side effects are actually good side effects with a lot of these medications, which is why we found out they work for other things. And for me, the pain and the emotional and physical pain of overeating and my pathologic eating patterns and pathologic thought patterns were so bad when I started that I was willing to tolerate probably some pretty bad side effects because number one, my mental and physical state was really bad. Number two, I know down the road because I'm educated in such things that, for example, 13 cancers are directly related to obesity, not to mention heart failure, which my grandmother died from, which is part of this whole thing. And, getting older, having what's called sarcopenic obesity, where you don't have a lot of muscle, but you have a lot of fat. So you can't carry it around, right? I watched my grandmother sit in a recliner for 10 years because she didn't have not have the strength anymore to carry her body around, which made me really sad. So when I look at those, like those will happen. Those were going to happen to me if I kept going versus all right, let's try it. If the side effects really suck, I'll stop. I'll figure something else out. And it was an absolute game changer for me. It in every way, emotional, physical, professional. It catapulted me into something very, very different, a very different life. It's hell of a midlife crisis. I mean, your response might. It's like I need to be those commercials. These well, what is it? These results aren't typical, but you know what? They are. I mean, if you get out there and you look, I mean, if you're looking on Facebook and you're looking on TikTok, you're in the community, right? So you see these results. They are typical, which is pretty freaking amazing.
Someone asked why they changed the name of Mounjaro. They didn't change the name of Mounjaro, but much like Ozempic came out first, which is semaglutide for FDA approved for diabetes. Then Wegovy came out. It is semaglutide, FDA approved for long-term weight management. So they didn't change the name. They just added a new sticker and a new pin, essentially.
And a terrible name. Don't forget the terrible name.
Yeah, and a bad name and an ugly pin.
Ugly pen, ugly everything, whatever. It's fine. Somebody, the skin thing. If you lose rapid weight loss, no, a couple things. Not everybody has rapid weight loss on this. I did because I was eating everything that wasn't nailed down because I couldn't handle living in my own head. So I did in the beginning, right? It was like, and then like the slowest effing weight loss ever toward the end. But my weight's been about stable. I've been saying 8 months forever. It's like 11 months now. I'm 11 months at the same weight. So I was like, holy crap. My bat wings are better. That's kind of snapping back. Yeah, my fourth grade art teacher flab is better. And my stomach flab is a little better. I mean, I'm 50. I'm almost 50. Well, let's figure this out. 19 days from being 50 because I celebrate the whole month because, well, hell, why not? Um, it's slow going with that skin popping back, and it might not be perfect. I have officially asked my plastic surgeon if she can do anything, and I'm like, because there's nowhere to like tuck it up. It's the top part of my skin, like on my abdomen. It's like this like poochy thing that it was stretched out because I had a kid and then I was fat for a long time. So I was fat before that, by the way. It wasn't just a post kid thing. If you haven't heard me before, I got a lot of years of issues, almost 50 of them, 45 plus, with food. So my skin's been like big and then little. It's just like, it's a mess. But anyway, there are options. And I was like, how bad do they hurt? This, oh, sorry, that's my alarm to go live. And I was like, how bad do they hurt? She goes, oh, you got to go under for this one. I'm like, oh, hell yeah. Okay, that's better. Because she's like, no, it gets really hot.
Yeah, you gotta go under.
Because it's a Venus. I don't know what the hell it does. It's a shrink wrap. Okay, it shrink wraps your skin. Farrakhan is her name. If you want her name. So, okay.
So someone is on TRICARE and they asked about what step therapy is. So basically, step therapy, all companies are a little bit different what they require. Some require like 2 out of 4 things. Some require, like 6 things. Typically, they just want you to try a cheaper drug that does something similar. Sometimes it's as simple as metformin. Sometimes they want you on like weird things like Qsymia or phentermine. I think the last TRICARE I saw, Wegovy is now a prereq on the step therapy before you can use like the tirzepatide stuff.
Really?
I know, right? Yes. And we had a fight for Wegovy for patients.
You're going to have to. Wegovy is just as expensive as the other things.
It's more expensive. I don't know if they'll pay for that one first. It just has a list of medications. So yeah, they're all different. So we just need to find out. You just need to find out what they require. Some of them, I think the last TRICARE I looked at, like literally, if you can't answer like a question on step 3 or step 5, you can't even move past it. That automatically disqualifies you. And it's usually like, have you tried this? Yes or no. And if you say no, nope, we're done.
When we first started, how many of those federal ones did we try to push through? And just, it was like pounding our head against a wall.
Yes.
For a while, we actually had to charge more to do the government PAs because they were so horrible. Yeah. Because we don't bundle our costs. If you're with AMS, you know exactly what you pay for the pharmacy. You know what you pay for us. Hold on one second. So there's a birth control question up there. You guys can monitor that. I'm going to stop looking at my phone. I'm like, you guys keep me covered. But the birth control question, any GI based, anything oral that you take, I know. Just Neil, zip it. I'm like, I know there's a comment coming here.
Not for me.
Everything. My brain's barely in the gutter today, so leave me alone. So any pill form contraceptive you take is going to be affected by these. And they say anytime you change your dose or start, you should use a backup method. And they initially said barrier, but now they're really trying to move toward like an IUD or implantable, one that has a lower failure rate. That's about it.
Someone else asked.
Yeah, I'm looking that one up because she's talking about PMDD, and I wish Mandy was here for that one. I'm not sure what the best, if it's going to be, like a combination oral for PMDD versus like, because that's progesterone only.
Yeah.
And so would Nexplanon be. So I'm not sure.
Yeah, no, we need Amanda to answer that question. You know what? If you can go to AMS public group on Facebook and ask that question, I will send Amanda over there. She's our women's health guru.
Someone else asked about taking antibiotics while taking GLP-1s. Yep. I mean,
like antibiotics, like with birth control, or if it will make your antibiotics less effective.
No, if you're like on a GLP-1, can you still absorb the antibiotics? Like, can you still take your antibiotics while on GLP-1? Yeah.
Yeah.
Which is fun.
They might actually be absorbed better because it slows your transit time through.
Yeah. So probably take it with food to avoid some GI upset.
Mm-hmm.
That would be my only thing, is that it would cause a little bit more GI upset because it sits there longer. But
yeah. Will insurance cover maintenance doses? Insurance doesn't cover shit.
It might. I mean,
I
like,
know it
the
is
other
now.
Zepbound are approved for weight management. It's just a matter of your asshole their, prescription coverage wanting to or not.
Yeah. So because each insurance plan is different. Each one has different choices that your employer makes when they pick options. Some don't even have the option. And I did find out that Texas marketplace plans versus other state market that ACA plans are terrible, which is what I have currently as we speak. I mean, it is essentially it's $1,300 a month for a catastrophic plan that doesn't cover my doctors, it doesn't cover any meds, and I have a $14,000 deductible. So whatever.
And Debbie's asking if you can take herbal medicine and still take Zepbound.
I do.
I think it would be the only same caveat with antibiotics or any other medicine. Does this start to irritate your stomach because it sits in there longer? Cause a little bit of reflux. Otherwise, yeah, it shouldn't really affect it. It should be fine.
Yeah, just watch out for herbal stuff anyway, because well, that's another discussion. But hey, why not? Let's go into it. Um, Herbal stuff, and I take supplements. I take very targeted supplements. I take supplements to sleep. I do stuff. But I do take it with a grain of salt, knowing these things are not FDA approved. They are not as tested for contamination. They're not as tested for potency. It's just something I accept, in a risk of taking shit from Amazon.
What's our Facebook group? Our Facebook group is amspublicgroup.com. Or you can find us under AMS on Facebook.
Yeah, that's the easiest way to get there is amspublicgroup.com. It is what's the name of it? AMS Friends and something.
Friends and Wellness Group, I believe.
Friends, AMS and Friends Wellness Lounge.
There you go.
That's where I'm watching from.
The lounge. It's been Cheers for a long time.
A few times.
But yeah, AMS Public Group is the easiest way to get there. I have websites that redirect, so it's super simple. By design. Why am I so damn cold while I'm in Jaro? It's funny because it increases your metabolism, so this part doesn't make sense. But I honestly think it's just because you're losing fat. Like, freaking cold.
I'm always cold. I mean, Mo and I are the wrong people. We are cold weather weenies, but us trying to get into a pool is not.
Oh my God. I know. And I got to start getting back in the pool in January. I'm like in no mood. I'm like, it's cold, it's wet, I'm miserable.
Yeah. I have asked for Christmas like a heated vest for work, a portable heater for work. I have portable hand warmers. I wear triple layers. It's ridiculous. It's absolutely ridiculous.
That is super, super freaking funny. Somehow my insurance is covering Manjaro off label. Yeah, it does happen. Sometimes they just cover it. I'm like, where the hell are these plans and how do I get out of them? Digestive enzyme. Yes, I agree. Thank you very much for answering the question on the burps. You got to be careful what you're eating. Speaking of which, my friend who, I don't want to do that here. Anyway, people who, we do have patients occasionally who get really bad stomach pains and aren't like, we just need to change behavior to fix it, right? We just need to change what they're eating, when they're eating, how much they're eating. And we can navigate almost every side effect. By the way, here's a disclaimer again, this is not medical advice or legal advice or any advice. It's TikTok, it's Facebook, it's YouTube. Like, don't get your shit from here. Just hang out and chat. But we can mitigate almost every side effect. Vomiting is never an acceptable side effect of anything, really. Like, you can get a good puke, right? It's like getting a head injury. You can get one puke. You puke more than once, you need a CAT scan. Like, it's
what about Ipecac?
If you're taking Ipecac and throwing up, that's different. Because it is an acceptable side effect, I suppose. Okay? Vomiting is an acceptable side effect to Ipecac only. That's hilarious. You're an ass.
I know.
You're an ass, Neil. Jesus.
Paradise, Doc ordered Wegovy 10 days ago, no word yet. Is that normal? Well, it depends. So it is possible that if you're on a dose that's unavailable, they haven't contacted you yet. It is possible that they're waiting on your insurance company or the doctor to respond to something for that.
Or they sent it to Walgreens and didn't tell anybody and said, you need a PA, because Walgreens always pushes it back for a PA.
Or if you like send it electronically, it's possible it's lost in cyberspace somewhere because that happens.
I'm looking up
It did get
the
there.
Wegovy shortage again. Let's see, because they were supposed to be September.
Oh yeah, it's back order.
Oh, well, we're still. Oh, well, now they're also short the 1.7. So they were only short up to 1 milligram. Now they're short to 1.7.
God, they really shit the bed on this drug. Wow.
Like, yeah, Eli Lilly's like, here, have some Zepbound. Have some
Yep.
Zepbound. They have more Zepbound available in 2 weeks than Wegovy's been for months.
Oh,
Unbelievable.
Wow.
Okay. All right. Enough, Wow. I don't even know what to. So the best, if you're being prescribed Wegovy and you're doing any dose below 2.4, it may be hard to get.
oh. Well, we should just start everybody at 2.4 then.
Absolutely.
Right. See how that goes.
Yeah.
Well, it'd be great for the ER population because we don't have enough patients in the ER as it is. So let's just send them all there by starting them on Wegovy
Well,
2.4.
I'll just bring it up now. So there's been some patients like hopping on our old platform, and they've called around, and all they can get is 2.4. So that's what they want, which is an absolute terrible idea. I mean, some people will start that very lowest dose, and it still be really strong of semaglutide. I mean, I started at the lowest dose, and I was there for 7 weeks before I needed to move up, and then 0.5 another 7-8 weeks. Yeah, there's some people that need to go up immediately, but if you start at 2.4, you're going to be sick. Like really sick.
Like ER sick. And then your doctor is going to say, well, we can't put you on it again. Or God forbid, it's so strong of a dose, it throws you into pancreatitis and nobody will prescribe it again.
Oh.
Yeah, I mean, you're looking at like at least 4 days of vomiting, I think, if you go that high and you start puking, because it's a very long half-life. And even with meds, people puke through it.
Yeah. It literally like, it shoves your GI tract at that high of a dose. It would shove your GI tract right into reverse. Here goes everything. Let's Ipecac. There you go.
Let's
What do
see.
we?
Saxenda versus Wegovy thoughts. I did try Saxenda. I think in the studies, some people have good success with Saxenda. In the studies, Wegovy is far greater.
Okay.
I lost some on Saxenda. Insurance approved it. It's a daily shot, which was difficult for me. I didn't realize how difficult it was until I started, like, summertime hit and vacation time hit, and now I'm having to take something with me for every single day. But if that's what insurance will approve, or if it's on your step therapy, it can certainly start some things for you. And like I said, some people do have some really good success with it.
Yeah, I think we have one patient that's either on Saxenda or Trulicity, and they're down like 60 pounds. So way more than statistical in the studies. Working really well for them.
Yeah. So if your insurance will cover it, go for it. Same with Rybelsus. Rybelsus in the studies did not have great results, but actually in practice, if you do it the way it's designed, because it's a little cumbersome, like the Saxenda, right? It's a daily pill. You've got to take it a certain way. I've never been such a fan of injectable drugs before this because I'd never taken any, first of all. But now it's like, okay, it's Monday. Guess what? That's it, and then I'm done. Like it's one bending the needle this morning, by the way, because I'm screwing around and tired. It's all right. I use the bent needle. Whatever.
It still works.
I don't care. I just got it in. I don't really, except the fact that it was bent and dull because I had to poke the damn thing twice. So I was like, so it hurt going in, but I'm like, I'm not wasting this damn needle. I'm not wasting the syringe. So anyway, but I'm a fan of the weekly. I really like the grab and stab pens. I am alone on this in this group. Everyone else likes the needles because they're for like compounded. Because right now I'm taking compounded until just because I like to try the pharmacies I can that we go through. And I really like the grab and stab pen. Yes, it hurts more, sort of, kind of. It's just easier. I just twist, poke, done. Thanks for playing. My life is outsourced. Um,
Let me go back. I'm trying to stay up and think because
yeah,
I
you
missed a
stay up
few.
because and
Yeah.
today it's a good day today. Holy crap, we got a lot of people and a lot of people talking. I love it. Oh,
Has anyone had issues? Oh,
go ahead. And we cannot miss this Eli Lilly back in stock comment though.
done. Has anyone had issues when stopping Monjaro for a few months and then starting again? Yeah. So if you stop and then start again and you want to go back to that same dose you're on, you will likely have some pretty significant side effects again. Typically recommended is, if it's been 3 months, starting back at, square one, let your body adapt to it again. I mean, you might be able to ramp up very quickly after that.
Mm-hmm.
But yeah, we've had patients that have started to stretch their doses out, like 14 days and they're at like 10, 12 and a half just to make it last longer. And they start getting side effects and getting sick again.
Oh, okay. So good. Somebody actually answered that Manjaro question. So 2 Manjaro questions.
Yeah.
One said, will it be approved for pre-diabetics? Very rarely. It just depends on the insurance company. And when we tell our patients, call the insurance company and ask them what the clinical criteria are for approval. Because don't bother paying. Well, your doctor will do a PA included in all the crap you pay your doctor because they bundle if your primary doctor, for example, and also some telehealth providers bundle their cost of the PA. Like they assume everyone is going to get a PA, so they put that in their cost. I don't like doing that because a lot of our patients don't get PAs. I don't want you to pay for something you're not going to get. So we separate all of our costs out, which seems nickel and dimey, but I don't like to bundle because I like people to pay for what they pay for, what they get. The other one was so you have to call and ask what clinical criteria will be approved with a prior authorization, and ask them because it'll save you some money. Like if you're with AMS, it'll save you some money. Well, shit. What was the other Manjaro question? Oh yeah, is it out of stock? Manjaro's not out of stock. You can get it. If your pharmacy can't get it, get another pharmacy because you can get it everywhere.
Yeah, I'm not seeing much shortages of Monjaro right now.
Mm-mm. All right, you guys grab the questions real quick. I'm going to check the FDA site and see what it says.
Yeah. Scroll back up. All right.
How do you know when to titrate the next dose of any of these medications? If you have side effects that are pretty epic, then you're not going to go anywhere, right? You're going to stay at the same dose until you get used to it. And you will, more than likely you will. We very, very rarely have these media awful stories. Okay. You never take 2 of these together, by the way. That'd be dumb. And it could kill you. Don't do that. And the people that do that are doing it without their provider's knowledge. I hope to God. Period.
Mm-hmm.
What else am I going to say? Oh, yeah. If your appetite suppression sucks, if your food noise is terrible, talk to your provider and say, listen, some providers go up by protocol. Like they go up every month. We don't. We do it very individually because some people don't need to go up for months and months.
Yeah. Let's see. Someone's asking about weight loss on low doses, or it's only the higher dose. So in the studies, like let's say for like Wegovy, it's the 2 highest doses that are the weight loss doses. But I don't know if you were on earlier. Like I lost my weight at 0.25 and 0.5 on semaglutide. Like that's where I needed to be. That was plenty strong for me. Everybody's body chemistry is different. Some people will be able to stay at low doses and work very well. Other people will ramp up to the max dose very quickly, or even get to like a moderate dose before they start to see some effects.
Or some people will go up and realize I was getting better suppression on 5, and then they'll go back down. So we work a lot with people on that.
Yeah, I think my husband started losing immediately on the lowest doses of Wegovy, but his provider increased every month. And then, of course, there was a shortage, so you kind of had to increase. But, I mean, you and I saw him that first month at an Ironman dinner, and, like, my husband, the big guy, and, like, it was, like, this much food. And he was like, I can't, tapped out, can't do anything else on the very lowest dose.
So on the FDA website, real quick, tirzepatide is listed as currently in shortage, but it says all doses are available.
Maybe we should thank them for listing it still as currently in shortage, because
I think they're doing that on purpose.
That's fine with me.
Because they know what the demand is. I mean, they know as soon as they list it as not on shortage, they're going to have to go back and do it anyway because the demand on this is ridiculous. Not ridiculous in a bad way. It's just we finally have a drug that works, right? Okay, so Wegovy is listed as currently in shortage. However, the only dose that is available, listed as available, is Wegovy 2.4, Ozempic 1.34 milligram pens. The other pens, the 2.68 pens, are not available at all anymore. And then the initial pens for Ozempic are the 0.68 mgs per mil are available. They really need to make Ozempic easier. I'm sorry. I'm like, and they're cutting out one of those, but I'm like, what the frig, people?
That's hard.
Anyway, so and the shortage reason is the demand increase for the drug. No, it's not.
It's
You knew this was
nearsighted.
going to be a blockbuster.
Nearsighted.
Yeah, exactly. Nearsighted. That's what it should be.
Yeah.
Okay.
So someone wants SJ wants this for PCOS, but she's scared she won't be able to get it or afford it. So we have seen this thing work magic for PCOS patients. Once they get to the weight goal, they drop down uncompounded, and they will do like half of a low dose, like 1.25 milligrams, and still have very good control of their PCOS. If like insurance won't cover it, there is always, depending on what state you're in, the compounded version that still works very, very well, because it's this. Can we say it's the same thing? It's very similar to.
It's a similar chemical.
Yeah.
That is sourced it's not sourced from Eli Lilly. So it is a similar chemical to tirzepatide. It is an equivalent type medication.
They look the same.
Potato. So somebody asked about something ordered through us. Hold on. How do we get tirzepatide? So we do medical care. So here's how AMS works. Let's talk about this a little bit since we're on the compounded train here. Toot toot. Active Medical Solutions is a full-fledged lifestyle medicine practice. We will do anything. We're actually probably going to maybe branch into men's and women's health in a little bit. All right. So we're migrating in there in 2024. We do some now. We do some. We've got a couple of patients that we'll work with. Well, because if you ask us, we do it, right? Because we're a full-fledged medical practice, pretty much. But there are just things we do for a lot more people than others. Like Hims and Hers as a telehealth practice. That's all they do is like sexual health, men's issues, women's issues that you're afraid to talk to your provider about. We will do that when people ask. But anyhow, so Active Medical Solutions is a medical practice. Like when you walk into a doctor's office, we treat all kinds of things. We're lifestyle medicine. We treat the things that'll make your life better. Weight loss is one of those things. So you pay for us monthly for medical care, and then whatever prescriptions, some of our patients are on semaglutide. They're going to be on like a lipo shot. They're going to be on some other things. We don't have our own supplement line. We don't push we don't do like groupie things. We do medical care. You know how they're like, oh no, if you have this stack, you're guaranteed to have better results. Well, our stack is all behavioral. So we'll tell patients how to change their behaviors to get better results from the drugs, which costs nothing beyond our medical care. So if you order, say you come to us and you're like, hey, I want to try tirzepatide. And we're like, well, your insurance doesn't cover it. You can either pay $550 for Zepbound, or we have options for compounded medication, tirzepatide-ish. And we do that. We have the pricing varies by pharmacy because we don't make the drug. We don't make any drugs. We just provide care. We don't make the drug. So the pharmacy will charge cheaper prices if the clinic pays for it. So we collect money from the patients. We send that money to the pharmacies. If you are our patient or you want to be our patient and you're in our states, we'll list those in a second. If you go to amstelehealth.com, click on Be a Patient, you don't get charged until we figure out if it's a good fit. And sometimes we'll have other states slip through. We had somebody today from one of the states we don't see because people really want to be our patients. So, and there's also a link on there. If you figure out that you're not in our states, a colleague of mine is nationwide except for Pennsylvania. So we'll send that to her. And then we've got Mindy in Massachusetts, and then we've got Maribel Campos in California. She's got a bunch of other states too. And they operate on the push platform as well. We do see patients again on the push platform. So we weren't for a while, we are now. So we have a private practice, but it's almost like it's like a different office, right? So we've got a regular office, and then we've got this other, like, in the mall office. That's push. We serve Oklahoma. We do not serve Oklahoma, but Nikki Baldwin will. Louisiana. It's always a tough question. We do have a Louisiana provider. Louisiana is a tough state. She doesn't like to take a ton of people from Louisiana, but we can do it by special permission. So if you do send us to be a patient, just say you saw us here.
Well, Louisiana has those rules about using these medications off label.
Yeah.
Where they won't let you.
Well, now, but it's not off label anymore for Zepbound. So
Correct. But before semaglutide wouldn't work because you couldn't get Wegovy. So
right.
still
So
can.
we can order Zepbound now for weight management in Louisiana because it's FDA approved for weight management. That makes my head hurt.
But then they have that video visit stipulation too, which we do, but it just
So we'd have to just get the video visit done ASAP with the Louisiana patients. Colorado, South Dakota. Okay, so let me tell you our states. Ready? I'm gonna do this. This is always a joke because I can never remember shit. All right, let's do mine first because then maybe I can remember those. New York. I'm literally going chronologically of where I've lived. New York, Ohio, Michigan, Florida, Texas, helping out Tennessee, and Virginia. Those are mine. All right, there we see if I do it that way, I don't forget them. Red team states are Arizona, Indiana, Texas, Louisiana-ish, maybe, possibly. Wisconsin. Oh shit, I forgot. Did I get Michigan? I got Michigan for me, right?
You got Michigan.
Okay. Miami. Sorry, that was last week. Neil said Miami instead of Michigan. He's never going to live that down. Miami and Ohio and in Florida. Indiana, Arizona, Alabama, Louisiana. Soft Louisiana, if we can do it. What am I missing?
You got them all.
I got them all? Okay.
Yeah. You didn't forget about Virginia this time.
I know, I didn't forget Virginia.
Wisconsin and Indiana. I don't know if you said Indiana.
She did.
So, I did. Okay. Lipo B, if I have a compound pharmacy, use now. So we have accounts with pharmacies. We can do it through the pharmacies we already have. We are willing to get accounts with other pharmacies. Sometimes that can take 6 to 8 weeks. But we are willing to. I like having that sounds like I'm running this shit. Ashley likes having lots of backup pharmacies.
Learn that lesson the hard way.
Unforeseen circumstances. I'm still holding the grudge.
Suicide. Yeah. Yeah. All right. So I'll get back to questions. Do we accept Medicaid? So we are a cash-based only service. We do not accept insurance with our practice. We can, you can use your FSA, HSA card to pay for our services.
So one of the caveats with Medicaid and Medicare, the way we prescribe services, the way we provide services, oh, hey, Linda, the way we provide services is not in accordance with federal Medicare, Medicaid, telehealth provision. I don't know the word. I should know the word, but I can't get it right now. Listen, it's Monday. So the way we provide telehealth services, because you cannot cash pay for services that Medicare or Medicaid will cover. But the way we do our services, I never see you in person first. So this is a different thing that Medicare and Medicaid will not cover. Anyhow, but we don't take any insurance. We will process PAs for drugs, for prescriptions, but we do not submit claims. We don't do anything with insurance. You can use FSA, HSA, but that's it. Some of the medical credit programs are weird and iffy because they only let you go. They'll only do, like, if you have a discount plan, your provider has to be contracted with them, and we do not contract. We are very straightforward. This is how much our service costs, and that's what you pay.
Let's see. Do we think injection site matters for weight loss or side effects?
In the
Oh, yeah.
individual, it does, apparently.
Yeah.
Not like globally. Like we can't say like each person will do better or have less side effects if it's in your abdomen versus your thigh. But per the individual, yes, rotate sites and you may have different effects, less side effects or improved results.
Hold on, we missed a question. Nana had to answer her phone. So monthly subscription. Our services are $89 a month. The medications, like you pay us $89 to do what we're gonna do, right? So say you've got like 5 issues you need to address, right? I got this, I got this, I got this, I got this, and this is my life's like my PCP handles this up to here because we require our patients to have a primary. My PCP's got me functional, but I want to be great, right? So we get you from here to here. We charge $89 a month. If you need 14 prescriptions sent to the pharmacy, we can do that. That's all included. Now, if we send something to a compounded, if we send something to any pharmacy, you have to pay the pharmacy for whatever it is, whether it's compounded or regular. So the medication, the only difference is we collect the funds and send them to the compound pharmacy because it's cheaper. Whereas if you're getting Zepbound, for example, we just ship the pharmacy order over to the pharmacy and you pay at the pharmacy. Was that clear, you guys?
I think so.
That makes sense. Sorry. Can you take Lipo BC if you have a sulfa allergy? Depends what it's compounded with, I think, right?
It has to be because I don't.
There's nothing in there by nature that a vitamin would cause that. Some vitamins cause irritation, for sure. I mean, think about vitamin C on an open wound, right? Super uncomfortable. Ow. It's like vinegar in a paper cup, man. That's how it ends. My provider, BCBS of Alabama, told me that it can be covered for weight, but they weren't going to cover it. Texas is similar. Yeah, it can be covered, but we're not going to do it. Like I said earlier, so every insurance plan has very different, like there are different pieces that your employer will pick, and your employer may not even have the option to pick anti-obesity medications. It's a very specific class. In the 1970s, obesity was ruled as a cosmetic disease by Medicare and Medicaid, which is what most insurances follow. So they called it a cosmetic disease. And then we had the movement of the last 10 years or so, I'm ballparking, at healthy at any size. So it made the public think that you could have lots of excess adipose tissue and still stay healthy. Might be healthy in that moment on blood work, but obesity is independently related to 13 cancers and 37 medical conditions it worsens or causes. So no, the answer is no. The problem is we kind of shot ourselves in the foot with these things. So insurance has a right to say we're not going to cover it, which they want to because these drugs are expensive. Is Zepbound even available? Yes, it is. It's getting out there. It's more available than Wegovy. We were talking about that earlier because Saxenda, Wegovy, and Zepbound are the 3 drugs in this GLP-1 class. That's it, right? Rybelsus. Don't forget Rybelsus. That are approved for chronic weight management. Wegovy is in shortage up to 2.4. Now, can you believe that? I did not know that until we looked it up.
Let me jump back. So if you have a sulfa allergy, you can't take Lipo B or Lipo C. The M part of the MIC can't be digested or can't be absorbed, and is the allergy, the methionine. So big no.
Okay, good. So all right, so it's the methionine that is so you can't do it if you have sulfa. Good, thanks, Neil.
Mm-hmm.
That is why Neil is the clinical boss over there. Lost 88 pounds on Mounjaro with the coupon and now not overweight. PA denied 3 times. PA will be denied for weight for Mounjaro 99.9% of the time because Mounjaro is not FDA approved for weight management. If you go for Zepbound, I would assume that idea, right? We already know Zepbound is approved for weight management more than Mounjaro ever was in the PAs that we do. And that's been what, 2 weeks? What was the date it was approved? Anybody remember? Just so I can lodge that in my head. Because Mounjaro was approved on June 6th, so I know that. Or June 7th.
So someone in the comments wrote that compounds are banned in Mississippi.
Oh, Mississippi too now? Did I know that?
Yeah, I'm looking it up and see if I can find
anything. I think I knew that. No, Mississippi's the one you can't ship any in. California, you can't ship any in. Sterile peptides. It's not just compounding; it's the sterile peptides that they're banning. I love it. I love state autonomy in the United States. I think it's fantastic.
They want everyone to be unhealthy. Good job, guys.
I know. I don't get into politics by design. Anyway.
D said 11/8.
11/8. Perfect.
There we go.
Perfect. So yeah, June 7th, 11/8. Oh my God, we're already a month in. How the hell did that happen? Like, time's going fast.
Yeah, it felt like I just wrote my first Zepbound prescription.
Damn.
Yeah, I mean, they approved it, and then when they approved it, they said not available yet. That it would be soon. So
yeah. So it was like a week and a half or so. But I'm telling you, they got it out fast. I mean, the fact that one of our patients already got 15s, awesome. Well, Blue Cross Blue Shield of Texas covers Zepbound. Again, you have to call your number and ask specifically what medication, or if you want to know just about Zepbound, sorry, I have a headache. What medication will cover, like if you want to know if Zepbound is covered, you call, you ask, is it covered? Will it require a prior authorization? What are the clinical criteria for it to be covered? Do I need step therapy? And they're used to these questions because that's all they field all day long, especially now. Yes, thank you.
Suggestions on what to include for a PA appeal for Zepbound. Was on Mounjaro for 13 months.
You have to know if your plan will even cover obesity medications first. I would, because if they're not going to cover at all, like if they do not cover any obesity medications, I don't know. I mean, I have very low faith in the insurance companies. I'm sorry.
Yeah. I mean, anything you can, like any diagnosis, like if it's, your BMI is over 27 for some of them, like you have comorbidities, whether that's high cholesterol, high blood
weight
pressure.
Loss on the other drug. So if you were on Mounjaro and lost the weight, what day you started, what your weight was, what your weight is now, what the percentage is, all that goodness, include that.
You want to repeat your list of what to ask the pharmacy as well?
Yeah. Well, not pharmacy, your insurance
I'm sorry,
company.
the insurance company.
Don't call the pharmacy. Lord knows. It'd be like, what the hell? No. So when you call your insurance company and ask first of all. So if you want to find out like which of these drugs, because sometimes they'll cover Mounjaro with nothing, like no PA, no nothing. Like, okay, well, let's go with that one. So you can ask them, will you cover, if you want to go just weeklies, right? So if we just do the weekly ones, do you cover Wegovy or Ozempic? Mounjaro, sorry, I had the sigh about the shortage in my head. Mounjaro or Zepbound. And if they'll say, well, we'll cover Ozempic and Mounjaro, but not Wegovy and Zepbound, because those are the obesity medications. The other two are diabetic medications. So if they say, we'll cover, we do cover Mounjaro. Okay, does it require prior authorization? They'll say yes. So then automatically people think, oh, I just have to get a PA and then it'll cover it. Nope. You have to ask them, what are the clinical criteria for it to be covered? Do I need to have diabetes? Because some people say, oh, I have pre-diabetes. Doesn't matter. Unless your hemoglobin A1C is 6.5 or greater, or fasting glucose, or unless you are diagnosed with diabetes, they might not be. Oh, God, thank you. We need to make her, hold on. Can I make you a moderator? I love you. Hold on. I can't. I'm working on it.
All right.
Seriously, I'm making her a moderator.
That's the other thing, is the insurance company or the pharmacy always make it sound like PA is just a magical thing. We just sent it over to your doctor for a PA. We just faxed that over to your doctor for a PA. They make it sound like this like magical button that here's the website they said for you to go to. Just go on there and just press this button.
Tell them I need it.
Yeah.
Click the PA button.
Much more complicated than that.
Do you know what tells them you need it? The fact that I wrote the friggin' prescription.
Correct.
I'm going to get off my insurance high horse now. I hate it.
Why? There's another one. My insurance covered Monturo for a year, and now they won't. They keep saying I need a PA. What can I do? Well, same thing we just kind of talked about. Like call them and see if a PA is even reasonable to do. It's possible they just won't cover it anymore. There's some insurances that are just like, nope, not anymore, even with a PA. Or you have to meet special criteria. Chiffon, type 2 diabetic, they deny me once I'm in my A1C is in normal range.
That's
On the
dumb.
medicine, they should not because it's we're using it as like basically a maintenance drug
Yeah, once
for
you
the
have diabetes,
diabetes.
you are diabetes in remission
Yeah. That'd be
because
like
you are
getting
being
you,
put on a drug.
be like using metformin and getting your A1C into normal range and then stopping the metformin.
Well, it's like being on, say you're on metoprolol for blood pressure and your blood pressure is good on metoprolol. They
Yeah.
never tell you to go off. You know why?
Because it
Metoprolol,
doesn't make sense.
right? Doesn't make sense. No, it doesn't make sense. But metoprolol is cheap, so they don't care if you're on it for the rest of your life. We got 4 minutes on the Facebook and YouTube live, and then we can keep going for a little bit on the TikTok.
See, why is it required to do a PA every year?
And what does PA mean? Let's start. Well, I'm going to grab that question too. PA is a prior authorization. It's when something's expensive and the insurance doesn't want to pay for it and it requires you to justify it. Sorry, Courtney, what was the other question?
Why do they require it every year? Some require it more often than that. Some require it with every single dose because that makes a lot of sense.
Right? Some of those Wegovy ones, every time you change dose, you had to resubmit.
Yeah.
I'm like, you spend the $75 and get compounded. Stop, like, just go around the system. Well, you have to now anyway because you can't get Wegovy.
Well, the worst part is like with CVS Caremark, the people who just got PAs done are going to have to redo them in January because they really don't want to cover this.
Does anybody have any poop questions? Because those are better than insurance.
Come on, I thought we'd get through one.
Nope. We always talk about poop. Every live we do, we have to talk about poop. Anyone out there constipated?
We can help you.
I swear. I was good. I was good. Hold on.
Jenna Adams, your thyroid med is cheap. They don't complain. Nope. They don't complain about cheap medications.
Hold on. I just got a really funny message from my husband that he said, my bitterness over having to go to Bel Air for a 30-minute fifth grade basketball game is fully justified. I'm like, yeah, absolutely. I already complained to Neil before the live.
I'm not sure, Linda. Linda, I am drinking an energy drink today.
Oh.
Sorry.
I'm a little jealous. I miss those. I can drink them now, though. I could not when I first started Manjaro. Holy cow, that was ugly.
Oh, God, there's the castor oil.
I did the castor oil. Hold on. Does it really work? Because it's not working for me. Does it slow all of your digestion? That's a good question. Hold on. And then I asked about poop, and then I missed it. Who gets compounded for 75? No, you don't get compound. Well, you can if you do really low doses of semaglutide sometimes. But what I'm saying is if you're going to spend $75 a month every time we change your dose, put that money toward getting compounded and not have to run the risk of, unless you want to, I don't know, unless you want us to do a PA every month, but who the hell wants that? Severe diarrhea. Oh, that sucks. Yeah, severe diarrhea is bad. Like, you can't do that. I mean, you can do that, but it's really not good. If you're having severe diarrhea, your doctor needs to work with you on your medications, your dose, what you're eating, the combinations of foods you're eating, and how much you're eating and when. Because if that's, and we find that more on semaglutide than Manjaro, but you gotta. We have 1 minute left on Facebook and YouTube.
Oh my gosh.
Oh my god, I know, TikTok. No particular desire to get too much smaller. Yeah, my body stopped. So Sandra Tyree over on YouTube said she's super close to her second goal, which is amazing. And my body just stopped when it was done. And here I sit, which is nice. And it's not at my goal. It's below my goal. So I thought that was pretty interesting because I knew where I wanted to go. And imagine that. I don't run the universe. Novel.
Someone's asking, is Wegovy the same as Ozempic? It's the same
Drug.
genetic
Generic.
drug, but they're approved for different things. The Ozempic is approved for diabetes, and the Wegovy is approved for weight management.